All right, y'all, caregivers, the things we got to deal with. The things we got to deal with. Here is my life for my husband, y'all. This is what you end up dealing with. All of these medicines, all of these medications. That was a pill splitter, which you need, and you can get from Medicare, usually free. So all these pills, this is how I have to keep them organized because he has a lot. Then he has a couple daily supplements he has to take, an eye pill, eye vitamin, and Zyrtec. He has to take CoQ10 because he's on a statin. Very important and necessary. Ask your pharmacist, they will tell you. Astanaxin is a really good antioxidant. I've been taking that, so I've added it to his pills. So every week, y'all, I'm sitting down and I fill his pill containers morning and night. He's got a lot of pills to take every morning, every night. And then I have a little cup that I pour them in, and I sit it there beside his glass of water so I know if he's taken them or not. Y'all got to find a routine and a way to deal with this. This is easy to grab and throw in the car. And I can grab this and throw it in the car if I have to. And then I do a little extra one that I keep in my purse just in case we are gone and he needs his medicine or he forgets to take it before we leave. So I keep an extra little one in with me all the time. The other thing you got to deal with is all the health check tools, y'all. The blood pressure cuff machine, very, very important. I have a little basket. I keep it all in here, y'all. I have a cardia rhythm check. It's just a 3-point EKG, but it's something. If he's having a problem, I can at least check and see if there might be a problem. This is a good investment. It's less than $100. Put it on your Christmas list if you can't afford it. An oxygen sensor. Got to have one of these in your little med kit. Thermometer, very, very important. I also have a wrist blood pressure cuff in case he's not where he can sit up with his feet down, or this one is not reading right. I think something's wrong. I've changed the batteries and it's not reading right. I also have this one as a backup, and this one is small enough I can throw it in my purse if I need to. I also have a Dario blood sugar little machine that goes to an app in my phone, and it also keeps track of his blood sugars. So when I go to the doctor, I can just pull it up and say, yep, here it was, before he ate, after he ate, whatever it was. We don't always check his blood sugar, but when he's feeling bad, I check everything. So this is really handy. And what else is in here? I have an extra pair of eyeglasses in here. I have a second oxygen reader and a second temple thermometer. So I can just really double check everything. And then there's stuff in here that he's been looking for, that his little trimmer he thought he had lost. Well, it's in his little medical basket. But this is my little medical basket, y'all. I like to keep everything in here in one place. I can grab it. The kids all know that this is here, and this is where everything is at. They all know it. And the great-grandkids all know that they don't play in this basket. I mean, yes, you got to have some rules. And the kids all know that all of his meds are in this tub. And they all know about his daily pill dispenser. So it's good to have other people know how to do everything. I have a 11-year-old granddaughter. She's fixing to turn 12. She can fill these for me. She loves to come down and do these pills for me when she's here. It's great. These kids can participate. So let them. And get all your tools.